Your legs are trying to warn you right now. And most people over 60 completely miss it. There are signs happening in your feet and legs today that could mean your heart is quietly struggling. Not next year. Right now. Most people brush these signs off as just getting older. They think it is normal swelling. They think it is just tired legs. But it is not normal. And ignoring these signs can seriously harm your health. So, if you are over 60, stay until the end, because what I am sharing today could save your life or the life of someone you love. Welcome back to Senior Health Secrets Over 60. I am Dr. Jessica Reed. If you are new here, make sure you hit that subscribe button and tap the bell so you never miss a video. Every week, I bring you real health information that your doctor may not have time to explain. Today, we are talking about something that I believe every single senior needs to hear: 12 silent signs of heart failure that show up in your legs and feet. This is important. This is urgent. And I am so glad you are here. Let me ask you something. Have you ever looked down at your ankles and noticed they looked a little puffy? Or maybe your feet feel heavy and tired even when you have not done much. Have you ever kicked off your shoes at the end of the day and your socks left deep marks in your skin? If any of that sounds familiar, please keep watching. Because according to the American Heart Association, heart failure affects over 6 million Americans, and nearly half of all heart failure patients are over the age of 65. That means if you are watching this right now, you are in the highest risk group. And the scariest part is that heart failure does not always feel like a heart attack. It sneaks up on you slowly, quietly, through signs you would never connect to your heart. The CDC reports that heart failure is a leading cause of hospitalization in seniors. And yet so many of my patients come to me saying they had no idea anything was wrong. They felt tired. Their legs hurt. They thought it was arthritis. They thought it was age. But it was their heart asking for help. I have been practicing medicine for over 15 years. I have worked with thousands of patients over the age of 60. And I can tell you with complete confidence that the most dangerous health problems are the quiet ones. The ones that do not announce themselves loudly, the ones that hide in plain sight. I have seen patients walk into my office thinking they just needed new shoes. What they actually needed was immediate cardiac care. Here is what most doctors will never tell you. The legs and feet are like a window into your heart. What happens down there often reflects exactly what is happening up here. So let me walk you through every single sign you need to know. The first sign is swelling in your ankles and feet. This one is the most well-known, but also the most misunderstood. When your heart is not pumping effectively, blood starts to back up. It pools in your lower extremities. Gravity pulls it down, and what you get is swelling. Medically, we call this peripheral edema, but I want you to think of it simply as your heart waving a flag. Margaret, one of my patients, came in last year. She was 67 years old. She told me her ankles had been swollen for months. Her daughter had been telling her to come see me. She kept saying, "Oh, it is just the heat." But when I examined her, we discovered her heart was only pumping at about 40% of its normal capacity. She had no idea. According to the American Heart Association, ankle swelling is one of the earliest and most reliable signs of heart failure in seniors. So, if your ankles look puffy in the evening, or if your shoes feel tight by afternoon, please do not wait. Get checked. But swelling in the ankles is just the beginning, because the next sign is one that most people completely overlook, and it hides somewhere you would never think to look. The second sign is pitting edema. Now, this is different from regular swelling, and it is more serious. Here is how you check for it right now. Press your finger gently into the swollen part of your ankle or shin. Hold it there for about 5 seconds. Now let go. If the indentation stays there after you remove your finger, that is pitting edema. The pit remains. That is a very specific warning sign. It tells us that fluid is building up in the tissue itself, not just surface bloating. Thomas, one of my patients who is 71, discovered this during one of our visits. He pressed his shin and watched the dent stay there for almost a minute. He said he had never noticed that before, but looking back, he realized it had been there for weeks. The National Institutes of Health identifies pitting edema as a key clinical indicator of fluid overload related to cardiac issues. If you press your leg and the dent stays, please call your doctor tomorrow morning. Do not put it off. Now that sign is alarming enough on its own. But the third sign is the one that shocks most of my patients when I explain what it actually means. The third sign is leg heaviness and fatigue, not muscle soreness. It is not joint pain, but a deep, heavy, dragging feeling in your legs, like they weigh twice as much as they should. Many of my patients describe it as wearing lead boots. This happens because when the heart is struggling, it cannot push enough oxygenated blood to your muscles. Your legs are literally not getting the fuel they need, so they feel exhausted even when you have not done anything strenuous. Barbara came to me at age 68, complaining that her legs felt like concrete every afternoon. She had stopped going on her daily walks. She thought she was just getting old. But her legs were not tired because of age. They were tired because her heart was working too hard to keep up. According to the American Heart Association, exercise intolerance and limb fatigue are among the most underreported symptoms of early heart failure in older adults. If your legs feel unusually heavy without a clear reason, that is your body sending you a message. And what comes next is something almost no one connects to the heart, but it is one of the most important signs I watch for in my patients over 60. The fourth sign is cold feet, not just a little chilly. Persistently cold feet even when the rest of your body feels warm. When your heart is not circulating blood efficiently, the extremities are often the first to suffer. Your body is smart. In survival mode, it pulls blood toward your vital organs and away from your hands and feet. So if your feet feel ice cold on a warm day, or if one foot feels noticeably colder than the other, that is a red flag. Robert, one of my patients who is 64, told me his wife had been commenting for months that his feet felt like ice cubes in bed. He laughed it off. But when we ran a full cardiac workup, it revealed early-stage heart failure with reduced circulation to his lower limbs. The NIH notes that poor peripheral circulation is a documented early marker of declining cardiac output. Warm socks will not fix cold feet caused by the heart. Only treating the underlying issue will. Now, I want to make sure you keep watching because the next sign is something that happens at night. And millions of seniors experience it without ever knowing it could be a heart issue. The fifth sign is nighttime leg cramps and restlessness. Now I want to be clear. Leg cramps have many causes, but when they happen consistently at night and come along with other signs on this list, it becomes much more significant. When your heart is struggling, circulation drops while you sleep. Oxygen and nutrients do not reach your muscles as well. This can trigger painful cramps that jolt you awake. Some of my patients also describe a restless, uncomfortable feeling in their legs at night, an urge to move them, a crawling or aching sensation. Helen, one of my patients aged 72, had been waking up 2 and 3 times a night with severe calf cramps for over a year. Her previous doctor told her to drink more water. But when she came to me and we looked at the full picture, we discovered her cardiac output had dropped significantly. According to the CDC, disrupted sleep and nighttime discomfort in the legs can sometimes be linked to circulatory issues originating in the heart. If you are losing sleep because of leg discomfort, please bring it up with your doctor and ask specifically about your heart. What I am about to share next surprised even some of my most experienced colleagues, because this sixth sign looks like a skin problem, but it is not. The sixth sign is skin changes on your legs, specifically discoloration, thinning, or a shiny stretched appearance on the lower legs and feet. When fluid builds up in the tissue for a long time, it starts to affect the skin itself. You may notice a reddish-brown color developing on your shins or ankles. The skin may start to look thin and almost transparent. In some cases, small blisters or weeping can occur where the fluid leaks through. Dorothy, one of my patients at age 76, came in worried about what she thought was a rash on her lower legs. She had been using hydrocortisone cream for months with no improvement. When we looked more carefully, the skin changes were classic signs of chronic venous insufficiency combined with early heart failure. The American Heart Association describes chronic leg skin changes as a downstream consequence of unmanaged fluid retention from cardiac causes. If the skin on your lower legs looks or feels different than it used to, do not assume it is just a skin condition. Ask your doctor to check your heart too. Before I continue, I want to ask you a quick favor. If this information is helping you today, please take just 2 seconds and hit that like button right now. It costs you nothing, but it helps me reach more seniors who truly need this information. And if you have a parent or a friend who is over 60, please share this video with them right now. It could make a life-changing difference for someone you love. The seventh sign is varicose veins that are getting worse. Now, most people think varicose veins are just a cosmetic issue. But when they appear or worsen alongside heart failure, they tell a deeper story. Your veins have tiny valves inside them. These valves are supposed to push blood back up toward the heart. When the heart is struggling, pressure builds up in the veins. Those valves start to fail. Blood pools. The veins bulge and twist. Frank, one of my patients aged 69, had always had mild varicose veins. But in the year before his diagnosis, they became much worse very quickly. His legs ached. The veins looked dark and rope-like. When we did a full workup, his cardiac function had declined noticeably. The NIH confirms that rapid worsening of varicose veins can be a signal of increasing venous pressure related to cardiac performance. Do not write off your veins as just a beauty concern. They are telling you something important. And what I share next is something something almost nobody talks about, but I see it constantly in my patients with heart issues. The 8th sign is a sudden increase in shoe size or ring tightness. This one surprises people every time I mention it. When fluid retention increases due to heart failure, your feet and legs can actually increase in size. Patients tell me their shoes suddenly feel too tight. Their rings will not come off their fingers in the evening. One of my patients, Gloria, aged 71, told me she had quietly gone up a full shoe size in less than 6 months. She thought her feet were just spreading with age. But when we checked everything out, her fluid retention was directly linked to reduced cardiac function. According to the American Heart Association, fluid retention causing noticeable changes in fit of shoes or jewelry should prompt a cardiac evaluation in seniors. If things that used to fit no longer do not shop for new shoes first. Shop for answers. Now the next sign is one that many seniors deal with quietly. They feel embarrassed to mention it, but you need to hear this. The 9th sign is reduced ability to walk without stopping. This is sometimes called claudication. But even without that medical term, I want you to understand the feeling. You used to walk to the mailbox without any trouble. Now you have to stop halfway. Your legs cramp. They ache. You feel out of breath. You need to rest before you can keep going. This happens because your heart is not delivering enough blood to your working muscles. James, one of my patients who is 67, used to walk his dog every evening for 30 minutes. Then gradually, he noticed he could only make it to the corner before needing to stop. He assumed it was knee problems, but it was his heart. The CDC identifies reduced walking tolerance combined with leg discomfort as a key early indicator of peripheral arterial disease, which is very often connected to underlying heart failure. If your walking distance has quietly shrunk over the past year, tell your doctor. That change matters. And what I am about to tell you next is something you might be doing every morning without realizing it could be a warning sign. The 10th sign is noticeable swelling that is worse in the morning than at night. Most people expect swelling to be worse at night after a long day on their feet. And for typical fluid retention, that is true. But with heart failure, the medilada dal saints mechir I fair, the pattern can flip. Fluid redistributes when you lie flat. It can shift toward your back and lungs overnight. And then when you stand up in the morning, it all rushes back down to your legs and feet. So if you wake up and your feet and ankles are puffier in the morning than when you went to bed, that is actually a more serious sign than simple end-of-day swelling. Patricia, one of my patients aged 73, noticed her feet were most swollen right after waking up. She said she had to shuffle to the bathroom because her feet hurt so much in the morning. Once we ran full tests, we found her heart was working very hard just to maintain resting function overnight. The American Heart Association notes that positional fluid redistribution is a hallmark of more advanced heart failure. Pay attention to when your swelling is worst. Timing tells the story, and the next sign is one I urge you never to ignore, no matter how small it seems. The 11th sign is wounds or sores on your feet that will not heal. When circulation is poor, even a tiny cut or blister can become a serious problem. Your blood is supposed to carry oxygen, nutrients, and immune cells to injured tissue. Without proper circulation from a struggling heart, that healing process breaks down. Small wounds stay open, but they get infected easily. In serious cases, this can lead to complications that require hospitalization. Edward, one of my patients at age 70, came in with a small blister on his heel that had been there for 3 weeks. He had been bandaging it himself. When we looked at his full health picture, his circulation had been declining for over a year due to undiagnosed heart failure. The NIH identifies impaired wound healing in the lower extremities as a serious sign of vascular compromise, often linked to cardiac decline. If you have a sore or wound on your foot that has been there for more than 2 weeks, please seek medical attention immediately. Do not wait. And I have saved one of the most overlooked signs for last, because this 12th sign hides in a place most people never even think to check. The 12th sign is blue or purple tint to the toes or feet. This is called cyanosis. It happens when there is not enough oxygenated blood reaching the very tips of your extremities. Your toes may look pale, bluish, or even grayish in color. They may feel numb. They may tingle. This is your body telling you in the clearest possible way that oxygen delivery is failing at the edges of your circulatory system. Margaret, a different patient of mine, age 74, noticed her toes had taken on a slightly purple color over several weeks. She thought it was just cold or poor circulation from standing too long. It was actually a sign of severely reduced cardiac output. When we did an echocardiogram, we found her heart was in serious trouble. According to the American Heart Association, cyanosis of the extremities in seniors is always a sign that requires urgent medical evaluation. If your toes ever look blue or gray, do not wait until tomorrow. Call your doctor or go to urgent care today. So here is exactly what you need to do starting today. First, do the pitting edema test on your own legs right now. Press your shin or ankle and hold for 5 seconds. If the dent stays, write it down and call your doctor tomorrow morning. Second, take off your shoes and socks and look at your feet and toes carefully. Check the color. Check for any wounds or sores that have not healed. Third, think back over the last 3 to 6 months. Has your walking distance gotten shorter? Do your legs feel heavier? Have your shoes gotten tighter? Write these changes down before your next appointment. Fourth, weigh yourself every morning before eating. A sudden gain of 2 to 3 pounds in 2 days can signal fluid retention from cardiac stress. The American Heart Association recommends daily weight monitoring for anyone over 60. Fifth, sleep with your legs slightly elevated. Place a pillow under your feet at night to help fluid drain back toward your core. This can reduce overnight swelling and morning puffiness. Sixth, and most importantly, ask your doctor specifically about your heart. Do not just say my legs are swollen. Say I have been watching my legs and I am concerned about heart failure signs. Bring this list with you. A good doctor will take that seriously. So let us do a quick summary of everything we covered today. Number 1, ankle and foot swelling. Number 2, pitting edema that leaves a dent. Number 3, heavy and fatigued legs. Number 4, cold feet even in warm conditions. Number 5, nighttime leg cramps and restlessness. Number 6, skin changes on your lower legs. Number 7, worsening varicose veins. Number 8, shoes and rings that no longer fit. Number 9, reduced walking ability. Number 10, swelling worse in the morning. Number 11, wounds that will not heal. And number 12, blue or purple tinting in the toes. You know what I love about this community? You actually care about your health. You are here. You are paying attention. You are doing the things most people are too busy or too scared to do. That takes courage. And I want you to know that catching these signs early makes an enormous difference. Heart failure is not a death sentence. When it is caught early and managed well, people live full, active, meaningful lives well into their 80s and beyond. Your heart can be supported. Your quality of life can be protected. But only if you pay attention. Only if you speak up. Only if you take what you learned today and act on it. I have one question for you in the comments. Have you ever noticed any of these signs in your own legs or feet? Or maybe someone you love? Tell me in the comments below. I read every single one. If this video helped you today, please give it a like and share it with someone you care about. And subscribe if you have not already so you never miss a video. Coming up next, I will be sharing the 5 morning habits that can cut your risk of a second heart attack in half. That is one you absolutely do not want to miss. I am Dr. Jessica Reed, and I will see you in the next video. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor before making any changes to your health routine.